Well, it has been 8 months since India reported the first coronavirus infection. The caseload is now second in the world, second only to the US. A major study of the disease in two of the worst affected states of Tamil Nadu and Andhra Pradesh by the US-based Center for Disease Dynamics, Economics and Policy, along with the two state governments, shows some unique patterns of transmission. Now, the study was conducted in the month of August and it covered over 5.75 lakh individuals who were exposed to nearly 85,000 confirmed cases of COVID-19. This is the largest study of the disease anywhere in the world so far. Now, the most striking revelation is the role played by super spreaders. 71% of those infected did not transmit the virus to anyone else, but just 8% of those infected accounted for 60% of all new infections. So where exactly is the transmission happening? Hospitals and the community in general account for a minuscule amount of COVID infections. Less than 10% of the transmission happens within the household, and more than 79% of the transmission happens during conveyance in sharing of a public bus or other modes of a transport. Now, children are least likely to die because of the infection. Those under 17 years have a mortality rate of 0.05%. However, children are silent spreaders and they pass on the virus to 18% of close contacts. This finding is crucial as India has now decided to open schools and colleges with parental consent from the 15th of October. India's case fatality rate has been less than 2% and is one of the lowest in the world. But if you take a look at the age-wise breakup of the deaths, shows that more young people are dying in India compared to other countries. The case fatality rate between the age of 40 to 70 is the highest in India. About 35% of the deaths in India are between the ages of 50 to 64. Now compare that to the US. The same age group accounts for only about 15% of the deaths. On the other hand, more than 58% of the deaths in the US are above the age of 75. Now, in India, just under 18% of those dead are above the age of 75. So those really are some of the highlights of this mega survey that's been done. To take this discussion forward, joining me now on the show is virologist and the CEO of Wellcome Trust DBT India Alliance, Dr. Shahid Jameel, affiliate professor of Global Health, director and senior fellow of the Center for Disease Economics and Policy, Ramanan Laxminarayan, and principal secretary to Tamil Nadu government, Dr. B. Chandra Mohan. Gentlemen, appreciate you joining us here on the program. Ramanan, let me start by asking you about the study itself. Now, this is the largest COVID study that's been done anywhere in the world, and it's showing up some very interesting data. Let's talk about the transmission, Ramanan, because what one assumed, and the survey is highlighting that only 8%, at least as per the survey that's been done in Andhra Pradesh and Tamil Nadu, are responsible for the maximum spread of the infection. Now, explain to us what you make of that. Are the 8% highly symptomatic, severe cases of COVID-19? And what about the balance? Were they asymptomatic? Because there's been a lot of back and forth on this business of whether asymptomatic are transmitting or not.
So Shereen, thanks for going over the highlights. Before I start, I just wanted to correct one small thing, which is, in terms of the proportion of cases that are transmitted in households versus workplaces, I just want to change slightly what you said. I think what we're referring to is the risk. Your risk of getting it from someone in the household is about 1 in 40, in 1 in 10. The risk of getting it from someone in the community is about 1 in 40. The risk of getting it from someone who you travel with for 6 hours or more when you're sitting, quite close to them, that is about, 80%. So it's not the numbers, it's just your risk of getting it. Now, getting to the super spreading. Now, this is not an unusual event in that sense. Super spreading is both a function of some individuals shedding more virus. They may or may not be symptomatic, and also a function of them being in a situation, whether in a restaurant or in a closed place or some place of proximity where they have an opportunity to give it to many more people. So super spreading takes both of these. The fact that super spreading happens is not surprising. We know, for instance, typhoid. There's a very old, story always of Typhoid Mary, this woman in the U.S. who was responsible for hundreds of cases in the UK. Was responsible for hundreds of cases of typhoid, even though she herself was never symptomatic. So we know that super spreading happens. It has just never been documented in the case of COVID with with any significantly large data set. Now, what that means is that we have now confirmed that some people spread more, but what we don't know is what the characteristics are of these people who tend to spread more than others. They may not be symptomatic at all. They may be asymptomatic. So at this stage, we don't know how to identify these super spreaders. We just know that a small proportion are responsible for the bulk of the spread.
Okay, small proportion responsible for the bulk, but we don't know whether this 8% that was responsible for the bulk of the spread were necessarily severely symptomatic or mildly symptomatic. But Dr. Jameel, let me come to you now with what this data tells us in terms of policy choices. We've just had the Ministry of Home Affairs here in India announce the Unlock 5 guidelines. Now, for instance, states and union territories have been given the option to decide whether they would like to reopen schools or not. Public transportation has started. Individual states are deciding whether metro rail services should be started or not. So in terms of what this data is telling you, what should the policy response, the policy choices now be in lifting further restrictions?
Thank you, Shereen. First of all, a disclaimer. As of today, I'm no longer CEO of the DBT Wellcome Trust India Alliance. I'm director of the School of Biosciences at Ashoka University. The policy has to be made based on evidence. And I think the best outcome of this study would be if this very large data set, which we should all be very proud of, that India, such a large study has come out of India. It would really be a shame if we do not take the lessons, the learnings from this study and apply it to policy. You're absolutely right about schools reopening. This study shows that children of all ages can get infected and pass on the infection to others. So this should really play on the minds of people who are going to open schools. And so does, metro, rail, bus services, cinema halls, all closed spaces where you are in contact with others over a fairly significant amount of time. So yes, these must be taken into account. Now that we have evidence, it would be a shame if evidence is not taken into account.
Okay, so closed spaces, you believe that is where the risk is the highest as per what the data is showing us as per this study that's been done. But Mr. Mohan, you are going to have to make those decisions. And as I pointed out, it is now pretty much left to individual state governments to exercise those choices. What is the Tamil Nadu government going to do based on the evidence that this survey has thrown up? Are you, for instance, going to allow cinema halls to reopen? Are you going to allow schools and colleges to reopen? What do you do with this data now?
It's very important to realize that this is the largest contact tracing exercise that has been done anywhere in the world. If you see the numbers, we have been able to track 1.2 million direct contacts and about 2.1 million other contacts as of yesterday. So in fact, the government of Tamil Nadu has constantly done a couple of things. One is get good quality data, analyze it, draw inferences, design interventions, implement them, get the feedback, and constantly iterate these options. Now, the first thing that has been said in terms of basically shared space, closed space, distance of less than 3 feet being a major cause of infection. So the government of Tamil Nadu, taking lessons from this data, has promoted 6 feet distancing throughout its behavior change communications. It has been very strict about creating outreach and also implementing through strong regulatory measures, masking and also distance. So we are already implementing the kind of findings that we have basically got from these places. And when it comes to transport, etc., the state has come up with detailed protocols that as necessarily take care of these issues to suggest who should be traveling and who should not be traveling. In fact, the whole aim is to see that people, the whole strategy of Tamil Nadu, especially after you have seen this evidence, has been to isolate people who are infected or even symptomatic within 24 hours of their being detected. So this itself is going to reduce transmission by about 70 to 80%. So this has been the cornerstone of the government of Tamil Nadu. We believe that early detection and early isolation are key to containing the spread, and we are working towards that.
Okay, you didn't answer my question specifically, though, on whether you will allow schools and colleges to reopen, what happens with cinema halls, amusement parks, etc., which are now, as per the national guidelines, off the prohibited list.
As of now, the government of Tamil Nadu, the Honorable Chief Minister, has decided that till October 31st, schools will not be reopened.
Schools will not be reopened. Ramanan, let me go back to the point that was being made there on transmission, and let's talk about what the data is telling us, which seems to be unique to India. Now, if we were to look at the fatality rate and what the data is showing us, that the younger population between 40 to 70, or in fact lower than that, the death rate is higher there. How do you explain that?
So, this is not an unexpected finding. People in India, particularly in the middle-age group, have a higher prevalence of comorbidities, diabetes, undetected hypertension. So this is always something that we had feared, which is that people in this age group are of what you call a higher immune age. So they are more likely to be susceptible to COVID and mortality because of these comorbidities. In fact, we find that 45% of people who died in this study were diabetic, and 63% had at least one comorbidity. Now, because we did not have data on comorbidities in people who did not die, we couldn't actually assess the risk of comorbidity, but this is still a pretty significant finding, given that 45% of the population in Tamil Nadu does not have diabetes. So it's clear that being diabetic does put you at risk. So that also indicates a very clear policy intervention, which is to find out who has comorbidities, because those are the folks to really prioritize. And I think that Tamil Nadu and Andhra Pradesh are doing things, along that direction. The second is really to do with, in the older age groups, the 85 plus, India actually has a, fairly low mortality rate compared to what one might expect. But that is because of what one would call a survivor effect. By the time people get to that age, if they were in weak condition or had comorbidities, they would have died even prior. So, in fact, the 80-plus-year-olds in India are pretty strong because, they made it to that place in the first place. And the survivorship bias means that you don't see as high a rate of mortality in those folks as you might see, as we saw in Italy or in the US.
Yes, that is very clear in what the data is showing up, that survivorship bias is evident. But Ramanan, one of the things that I wanted to check with you about was this business of mask wearing. And if as part of this study, did you find enough evidence to suggest that wearing masks is controlling transmission effectively?
We did not have data on mask wearing. And I would say that during the course of this study, remember, you're dealing with two states that are not, at all the average for India with respect to public health capacity. These are way out there in terms of capacity. And, as the LA Times noted this morning in its write-up, even the city of Los Angeles did not have the capacity for contact tracing that, Tamil Nadu did, for instance. So I think you're talking about states where the compliance is likely to have been much, much greater. So I don't think that, we didn't really have a control in that way to see who did not wear masks and therefore how much they got infected. I would have expected pretty good compliance in these.